Nebraska Medicine began setting up a tent Monday morning to help with overflow coronavirus patients. They say they don't need it yet, but want to be ready if they do in coming weeks. Chief photographer Stephanie Nolte tells you who will be seen there.
A first at Nebraska Medicine. They're setting up a tent outside of the emergency department as an overflow for patients with coronavirus.
Right now, we're not at a point where we need to use the tent for patient overflow, but this is preparing for the worst.
This tent will be used if the overflow at Clarkson Doctors Building South fills up. The goal is to treat patients with non-emergent coronavirus symptoms in an environment that's safe for them.
And also safe for patients who are in our department for other reasons, and especially vulnerable populations, as in the elderly, other people with comorbid conditions, immunocompromised patients, to keep the patients who have signs of COVID-19 away from that patient population.
People with fever, cough, shortness of breath, sore throat, but are able to walk and don't have respiratory distress may be cared for inside the tent. It will be fully functional with electricity, internet, heat, and air conditioning. There's room for 8 patients in one tent. A second tent may be set up here in front of the Monroe-Meyer Institute if needed.
There's dividers between each patient care space, and all the precautions that we use for the patients who we suspect may have this infection in the emergency department will also be followed in the tent in terms of personal protective equipment and distancing.
Nebraska Medicine says they don't need this tent right now, but they will likely begin using it next week to take a look at patient flow. In Omaha, Stephanie Nolte, 3 News Now.
Nebraska Medicine says do not show up at the tent if you want to be seen, and if it's an emergency, go directly to the emergency room.